morning. I'm Ravi Malina, consultant orthopedic surgeon specializing in hand and wrist surgery. Deformities affecting the distal radius and forearm can be quite disabling. Patients present with significant pain and restriction at the wrist, resulting in the inability to carry on with their day-to-day activities. Custom implant surgery provides a unique solution to these group of patients. Herein, I'm going to share with you all an experience of a patient of mine who was successfully treated using 3D implant technology and patient-specific instrumentation. These are the pre and post-surgery x-rays of the patient. Good morning, how are you?
I'm very well, thank you.
Good, thank you for coming. So how is the wrist coming on?
It's really good.
Good. And how is the pain?
I don't have any.
Don't have any.
No.
Now remind me, how many weeks are we after surgery?
It's 13.
Week 13 today.
Yeah.
Perfect. So please tell me what were the symptoms you were experiencing prior to surgery?
Incredible pain and certain angles where I used to hold something, it seemed the joint was slipping out of where it is, and it actually physically came out as a lump and you had to push it back in.
So the joint was just popping in and out?
Yes.
Okay.
Yes.
And it feels stable right now?
Yes.
Okay, very good. And after surgery, how long did it take for you to recover in terms of pain?
Probably about a week.
That's very good.
I got pain.
Very good. Now, in terms of the day-to-day activities, what were they that you were struggling with?
It was just everything really. When I wanted to hold something, I couldn't hold a cup of tea. It was sort of shaky, so I just had to transfer everything over to my other hand.
Okay. And how long did it take for you to start doing all those day-to-day activities without an issue?
After I had about week 6.
Week 6.
Because then I started driving again as well,
Okay.
which I found very useful because I was hampered without driving.
Okay. And in terms of pain before surgery, on a 0 to 10 scale, how much would you rate?
Probably about 8.
8. And now, on a 0 to 10 scale, after surgery, how much is it?
1 or 2.
1 or 2, okay. Good, good. What are your main hobbies?
I do a lot of sewing, and before my operation I couldn't hold the material in my left hand, and you have to hold it, as to do it you have to hold the material. And after surgery, few weeks afterwards, I was able to start my sewing back again because I could hold it. I couldn't hold it before.
Thank you for coming to see me today.